We're here today because we're fighting for ratios and for a fair pay rise.
It's time for a decent pay increase for nurses and midwives.
We don't want to hear your platitudes anymore, Gladys. We don't want to hear it. We don't want to hear thank you. We want money in pockets. The cost of living is going up.
Stand up, fight back!
We jumped through hoops. We're being redeployed, working in the vaccination clinics, in the testing facilities, and none of us have been rewarded for any of our hard work. Now they have offered 1.04, which is absolutely disgusting.
So we've asked for a 4.7% increase. It would make up for what was lost last year and simply match what was the government's commitment over the last 10 years of 2.5.
It just shows they don't care. They don't care for nurses. Enough is enough.
For 10 years, we have been calling upon the New South Wales Government for nurse-to-patient ratios on a shift-by-shift basis.
Quite often I would work 10 patients with an AIN. It was an extremely stressful environment where the patients all had dementia and they were very challenging.
I work mainly night shifts and it could be 1 to 4, 5, 6, 10 because we're working on skeleton staff. Some nights we work 12-hour shifts with no break.
That here in the state of New South Wales, we are not the premier state, we are the laggard state when it comes to properly staffing our public health system.
Queensland and Victorian nurses, they both got a pay rise. They've got their ratios in 2016, so we are really far behind.
It saves lives and it saves money. And it preserves the longevity of the capacity of nurses and midwives to keep coming to work. There's nothing like being forced to deliver inadequate care to drive nurses away from the profession.
It's like an elastic band, you can only stretch us so far before we break, and we're the backbone of healthcare.